traditionally, even the medical textbooks, when we hear about these diseases, we hear the manifestation erythema, right, which is redness. Well, in darker skin colors, we do not see redness. We see skin darkening. And a lot of times it is thought to be due to inflammation or scarring or some irritation, while indeed it could be something else like cutaneous lymphoma. And then we have to learn how treated CTCL is going to look, because in patients with lower skin pigmentation, the lesions may resolve completely, while in patients of color, you may have residual hyperpigmentation, darkening that may stay for a very long time and maybe even forever. And I think that again, having that in the textbooks and then having that in patients' handouts would be extremely helpful.
That's a really great point. I think we have to look more deeply and broadly at everything across the board, from the medical textbooks to the patient materials. Again, to your point, how it may manifest differently, how even if the disease is well managed, there may be residual. What does it look like on darker colored skin? Showing photographs, because I think when we show even just your basic photographs of patients or with the disease, it's always shown on white skin, and that isn't always the case.
Absolutely. And I think that it's important for the educational establishments to make sure that the young physicians, that nurse practitioner trainees, physicians assistant, nursing staff have rotations in the areas where there is high representations of people of color, where they can get experience. And I think that maybe the best language really is sometimes listening. So I think that learning from these patients, actively listening, following them, paying attention, and trusting their symptom expression and the expression of symptom severity is very important.